So the next topic which we are going for is heart failure. Anything failure is a very common term. If somebody cannot do the task up to given parameter, we call it as a heart failure. We call it as a failure. Suppose in 12th the student have passed examination, so barrier was 35%. Those who are not getting 35% will call them as a failed. That is a failure in particular subject. Okay, in Farm D you have got 50%, so those who will not get 50 will call it as a failure. Okay. Similarly, the heart is expected to do some work, and if heart will not able to do it, then we will call it as a heart failure. Okay. Now it will depend on the need of the body, because you know that as the body situation changes during exercise, during rest, that changes, and accordingly the requirement changes. So if the heart is not able to meet the body's requirement at any given time, we'll call it as a heart failure. Okay. So when heart cannot enough blood is not pumped by the heart to meet the tissue needs for the oxygen and nutrients. So why it happens? There can be many reasons for that. Okay. This I hope you will study in pathophysiology also, might have studied, or you will study it in therapeutics also. So it is because of the impaired contraction, that is, the contractions are not properly, and it is not complete contraction, and because of that the blood is not completely pumped into the arteries or aortas, and it may be impaired because of the relaxation and the filling of the ventricles, that they are not properly relaxed, and therefore the filling is not proper, and at many times it is both. So there are many reasons, but the easiest thing is in that is the heart failure is what? That inability of heart to pump the sufficient blood for the tissues, and not able to fulfill the requirements of the tissues. That much tissues oxygen and nutrient demand is not fulfilled, and they will show the sign. That means the heart failure. Okay. Now why there can be heart failure? What can be the reasons of heart failure? Okay, this is because of the dysfunction of the contractile myocardial cells and endothelial cells. It can be because of the endothelial dysfunction, that is result into build-up of atherosclerotic plaque, then growth of cells, inflammation, activation of platelets, and then it can cause simultaneously certain diseases, that is coronary artery diseases. It can cause hypertension also. It causes leading to heart failure. These are the also reasons behind heart failure, because coronary artery diseases supplies less oxygen because of there is a ischemic injury. Because of the injury, the active or the functional muscles, they are damaged, and because of that the function reduced, so that cause the problem. Same is the case with the hypertension. If the hypertension is prolonged for long period of time, then you know about afterload, preload, you have read about it. So because of the increase in the afterload, the load on the heart increases, that can result into injury to the heart, and because of that injury, which is because of the hypertension, heart may get weaker, and thus the pumping will be lesser. Okay. Then next thing is other causes are hyperthyroidism. In hyperthyroidism, if you remember or you just go back, you will find that when thyroid glands are secreting more T3, T4, thyroxine and triiodothyronine, so in that case they causes sensitization to sympathetic nervous system, and therefore the anti-adrenergic agents are used in the hyperthyroidism, because the thyroid hormones, they causes sensitization to the ANS or sympathetic system, and because of that there is a problem. Then in case of fluid overload, when the kidney is not properly working and it is not excreting the fluid, then fluid will remain in the body. Because of that the blood volume will increase, and because of that it will come more to the heart. Heart will get more end diastolic volume, and because of that end diastolic volume which is increasing, that will not be able to or sufficiently pump up and that will be problem. That certain diseases, certain drugs are there which are used in arrhythmias or dysarrhythmic agents. In that cases also there is a cause of heart failure. The drugs which causes excessive retention of sodium and water, this also able to cause, or this will also result into the heart failure. So what happens when there is a signs occur, you know about it, that there are variety of feedback mechanism. They are continuously monitoring about heart, of the function of heart, and therefore we get the reflex activity or action through the cardiovascular center. So what will happen because of that? That baroreceptors will sense lesser pressure because heart is not pumping enough. Then there can be, because of that, increase in the sympathetic activity and neurohormones. Then it will cause blunting of the baroreceptor. Baroreceptor will not able to sense the pressure properly, and therefore it will give wrong information to that. Then the endothelin will be released in more amount, which result into vasoconstriction. Then renin angiotensin aldosterone system, that is called as a RAS, renin angiotensin aldosterone system. So that will cause that will increase the preload and afterload. Why? Because renin angiotensin causes two important activity. It causes fluid retention is one thing, and second thing it causes is the vasoconstriction. We have seen this during hypertension. So when RAS is activated, so it causes both. Preload increases because blood volume increases, because excretion of urine is reduced, and second thing it causes is increase in the afterload, because there is a vasoconstriction because of the angiotensin effect. So because of this, the load on the heart will increase, and it will cause more problem. Stretching, hypertrophy, ventricular remodeling, and progressive deteriorations, these are the further activities. Now something I'll explain is stretching means what will happen. As I told you, if fluid volume increases or the venous return increases, because of that the blood which is present at the end of diastole, that increases. But if that is too much and the heart is not pumping, that some of the blood will still remain. Normally it is not, it is expected that what is the end systolic volume at the end of systolic, whenever the systole is there, and that is very small amount. But if that go on continuously piling up, during every pumping, the end diastolic volume is very high, and because of very high end diastolic volume, the enough pumping is not there, and that will remain in the heart. So that will cause stretch on the heart. I told you about Frank Starling. So because of that, heart will try to force it very forcefully, because this is the Frank Starling law. But due to stretching, many things will happen. It will reduce the blood supply to heart is one thing. We have seen this in angina. Second thing is that when we stretch it anything too much and for longer period of time, then it loses the elasticity. Simply we have seen. Similarly, that Frank Starling law will be applying up to certain time, and later the contraction will not be remaining as forceful as it should be. So this is another problem, it will be there. Then second thing is that whenever there is a injury because of the ischemia or higher workload, so because of that too much workload is there, not sufficient, the demand will be much more. It was not exactly angina, but the demand is too much, and because of that too much demand, it is not met, so it will cause ischemic injury. That ischemic injury will give rise to the release of various mediators, and in that some of the growth factors will be released, and this growth factor will cause the hypertrophy. Hypertrophy means that is the tissue is formed, additional tissue is formed, but that does not have the function like heart. Okay, so heart size will increase, heart mass will increase, heart weight will increase comparatively, but function will not increase, rather function may decrease, and this is called as a hypertrophy. Okay, so more and more tissue is formed. We call it as a scar tissue or fibrous tissue. So this is what hypertrophy. Then ventricular remodeling, that is what happens is the ventricle becomes slightly increased in the size, There may not be hypertrophy, may be hypertrophy, but just like because of it's something like elastic. So if the elastic is stretched again and again and again and again, so what will happen is elastic size will increase, but the contractile force will not be increasing, or rather it will decrease. So similarly there will be called, that is called as a dilatation or ventricular dilatation. So it can be hypertrophy, it can be dilatation, or it can be both, and this result into progressive deterioration of the heart. When these things happen, this stretching, hypertrophy, ventricular remoltre or ventricular dilatation, so this causes progressive deterioration of the heart, because the effect it is the physiological process to make the effort, or it is the homeostatic process that heart should do something better, but it is not useful, because it is working against the available resources, and therefore it will cause progressive deterioration, and stepwise still or cyclic wise it will still go on deteriorating, still it will go make more damage, and therefore this progressive damage can be prevented by using certain drugs, by having the treatment of the heart failure. So what are the signs symptoms of the heart failure? It will varies with the degree of failure, and whether it is right side failure or left side failure. Okay, so shortness of the breath with the activity, because body will try to compensate with the respiratory system, just like when exercise or when there is a long run, very much physical activities are there, then you will find that the our rate of respiration increases, there is a shortness of breath. It is actually physiological mechanism, so that the maximum air comes in, more oxygen is supplied, and heart is working also simultaneously, increase in heart rate, increase in force of contraction. This is what you have seen in fight and flight mechanism. But here it is there with a small exercise also, and that will indicate what will be the situation. Then crackles in the lungs will show the crackling noise. Okay, the edema in the ankle, particularly if it is a right ventricular, because there is no enough space in right atrias and right ventricle to fill it completely. Then other vascular problems. Then the sputum will be pink and slightly frothy in nature. The person will have anxiety, person will show restlessness. Then there will be cough, moist skin, extremities may be cool and pale, the color will be lesser, darker than that, or it shows the sign that less blood supply is there. There are this you will study detail in again therapeutics. There are various classes of heart failure, class 1, class 2, class 3, class 4, and that indicates from very minute symptoms to the major symptoms, and accordingly the treatment can be given to the patients. So what are the drugs which are used to treat heart failure? There are various ways by which these are classified on the basis of either mechanism of action, on the basis of chemicals, or on the basis of the criteria wise category, in what category the patient is and what should be the drugs. What are the drugs which are used? These are the inotropes, or we call them as a positive inotropic agents. What they will do is they will strengthen the myocardial contraction, they will increase the contraction of myocardium, and because of that it will cause the increase in the cardiac output, because cardiac output was reduced. Because of the reduction in the cardiac output, tissues were not getting enough blood, so we'll call it as a these are the inotropes. Example of these are digoxin we shall study in detail later. So one of these is a digoxin. Then another is Dobutrix, that is dobutamine, Natracor, Primacor. These are the drugs which are used in the treatment of heart failure. Then other are AC inhibitors. They are the drugs of first choice, because we see that we have already seen in hypertension that these are the drugs which are acting on renin, angiotensin, aldosterone system, and they can act at various places. We have seen all these places where they are acting. Okay, renin 2, angiotensin 1, angiotensin 2. So because of that, angiotensin 2 will having very high activity on blood vessels. It causes blood vessel contraction. So this will, if they are inhibited, it will not be there. So veins and arteries will be dilated, and if the arteries and veins are dilated, it will cause decrease in the workload. It will cause increase in the perfusion of the organs is one thing. Then second thing is, it also acts on this aldosterone increase. Because of that, sodium is excreted out, and this is another benefit. Then we have got it causes release of atrial natriuretic peptides. These peptides are found to be very good because they will cause natriuresis. So sodium will be excreted, along with that water will also be excreted. Because of excretion of sodium and water, the sodium load will be reduced. We have seen sodium load is dangerous in heart failure. Then another thing it will cause is, because of that, blood volume will also decrease. So there are multiple actions these drugs are showing, and therefore AC inhibitors are important. You know what are the adverse effects of AC inhibitors. You have seen them earlier. Okay, that is it causes cough. You know the mechanism of cough. Just I'll not wait for this, but those who remember can just put this without seeing how much you remember. You can put it on group that these are the adverse effects of AC inhibitor and why these adverse effects are there. You just test yourself, because if somebody asks you, and basically you think very important is, being a PharmD, you are expected to be drug experts, and then during pharmacotherapeutics you have to select the best possible drug. Or if the person is having any kind of adverse effect, then how to change drug, because you have to understand what are the basic good things and bad things about that drug. So considering the patient, what good should be there and what bad should be there, that you should be understanding. So your study in the pharmacology should be in maximum details. Then only it will help you in deciding the proper drug. So please go through it. You will find it interesting. Find out various drugs. You can make the table of various AC inhibitors. If you can remember them, what are these? They are various prils: enalapril, captopril, lisinopril, ramipril. There are many such prils, except April, I told you that time also. So there are many such drugs are there. You can make the table about it. What are the good thing, bad thing, what is the pharmacokinetics. You can make the table of all these prils. Then next in that is angiotensin receptor blockers. We have seen that they are offering some benefits over AC inhibitors. They do almost same job as the AC inhibitors are doing, but they have certain additional beneficial effects. That is, they do not cause any kind of adverse effect as the AC inhibitors can cause, and these are very important. What are these? These are again sartans. There are many sartan: candesartan, telmisartan, valsartan, etc. And out of that, valsartan is comparatively more preferable in heart failure than other sartans. Okay. Then next thing is beta blockers. You have studied beta blocker in too much details. So we know about these all beta blockers, how these beta blockers are working. We have seen what are their mechanism of actions. So what they do, they will suppress the activation of sympathetic nervous system. So it will prevent the ventricular remodeling, and because sympathetic nervous system plays important role in the ventricular remodeling. Remodeling, I told you, there is a dilatation or ventricular structure that changes, and gradual change in the ventricular structure we call, that is hypertrophy as well as dilatation, the change in the increase in the size of ventricles. They causes because of that the size increases, weight increases, but the force is not increasing, and therefore enough amount of blood is not pumped through the heart. So that size is not important. Actually the force of contraction is important. So they are usually used in combination with the AC inhibitor or ARBs and diuretics. Example of these are metoprolol, propranolol, etc. So again go through this, what beta blocker and what can be the mechanism. The next are the drugs which are important. They are the diuretics. Diuretics are the drugs which are causing increase in the urine excretion, and this urine excretion increase is useful because it will cause decrease in the blood volume. So if the decrease in the blood volume, that means decrease in the amount of blood flowing through the blood vessels, that will cause decrease in the venous return. Decrease in the venous return means it will cause decrease in the preload. Simultaneously, less blood volume means again in the arteries, if the blood volume is less in the arteries, that means decrease in the afterload, and less blood has to be pumped comparatively than previous one, and this will thus help, this will thus reduce the load on the heart, and thus it will be helpful. So it is used in acute and chronic heart failure. Loop diuretics are preferred, particularly when the degree of renal insufficiency is present. Then loop diuretics are very powerful diuretics. They causes very good increase in the water excretion and salt excretion. So both will be excreted, salt and water both will be excreted. It will also cause, as I told you, it will cause decrease in the plasma volume and increase in the sodium and the water. So thus it will also reducing sodium load. Thus it will decrease the preload and also afterload. It also vasodilatory effect that causes decrease in the afterload. Some of these agents are having slight vasodilatory effect, but anyway they will reducing afterload. They will also means simultaneously only diuretics are not useful. So there should be certain drugs which can enhance the cardiac contractility and vasodilation. Now very funny and very important and interesting thing you may find, if we'll go for the drugs which are used, again will make the things. Okay, the first drugs are what? Inotropes. In inotropes it is a digoxin. Then next is what? Dobutamine and these drugs. So what is dobutamine? Dobutamine, if you see that it is a specific beta 1 agonist or dopamine. Okay, they are used. At the same time you are seeing the beta blockers. So that way it is a contradictory. And the problem is similar. In all cases there is heart failure. In some cases we are using what? Dobutamine. Dobutamine is a beta 1 agonist, and then we say that for treatment we are using beta antagonist. Okay, that means beta blockers. So why such? So beta 1 agonists are used in a condition where the heart pumping has reduced too much, where the cardiac output has reduced to almost 60%. So in that case, to improve it, we have to increase the pumping of heart. So in that cases we are not going to use beta blockers at any time, and we have to use such kind of inotropic agent which will cause increase in the force of contraction, which will, okay, this is sort of an emergency measures to save the patient. However, beta blockers are used in a patient where already proven adrenergic activity is there. Example, we have seen that ventricular remodeling, where there is a hyperactivation of adrenergic system is there, that is trying to cause more pumping but not possible. So in that cases we are trying to do it with the beta blocker. So this is again very important, that in what condition we are using beta blockers, in what condition we are using beta agonist. Okay, otherwise and this type of confusing question I can definitely ask. Is it possible for same problem we are using one type of agonist and one type of antagonist? Can it possible? So yes, it is possible in this condition, but mind well, here the situation, the disease may be same, okay, but the conditions are different, the staging is different. Okay, for first or second stage we can give for beta blockers, but if it goes in third or fourth stage, and when the pumping is too less, to improve the pumping, we have to go for the inotropic agents. I hope this is clear. Try to understand, this is very important, and this will help you in understanding in better way. Then next are the aldosterone antagonists. They are also called as a potassium sparing diuretics. So they are used in a moderate to severe heart failure. The increase in the aldosterone result in the interstitial fibrosis and decreased systolic function, and the increase in the ventricular dysarrhythmias. So this aldosterone which is increasing, I told you even renin is causing, or renin angiotensin causes aldosterone increase. So when we block it, then automatically it is also simultaneously affected. However, we can use addition to that aldosterone antagonist. They are particularly spared the potassium, because the other diuretic agent along with sodium, they will also excrete potassium, but potassium is comparatively lesser in a body, and if it is excreted out, then it can cause hypokalemia. Hypokalemia means less potassium. Okay, so this less potassium can be dangerous. It is very, very dangerous, because potassium has to be maintained in a proper level. So if this potassium is not maintained, then it can cause another problems in nerve conduction, impulse conduction, including impulse conduction in heart. So that can be a problem, and therefore it has to be this potassium sparing diuretics, we call them. So potassium, these aldosterone antagonists are also called as a potassium sparing diuretics. So they are used, and example of this is spironolactone. It is used along with the ACE inhibitor, loop diuretics, and rather many times it is used with the digoxin, because we shall see about it, which kind of diuretics should be used with the digoxin. This is only diuretic that can be used with the digoxin. No other diuretics can be used. We have seen other diuretics just now. These other diuretics where they are called as a loop diuretics, if you will see. So this is aldosterone antagonists are also diuretics. These are also diuretics, but these are the loop diuretics. They are more powerful. They are causing excretion of sodium and potassium both. However, these are the agents. They are causing comparatively more sodium excretion and lesser potassium excretion, and therefore we call them as a potassium sparing. They will not allow excretion of potassium. They will spare the potassium. So we call them as a potassium sparing diuretics. Okay. Then other treatment is vasodilators. Already we have seen that they are ARBs. They can cause vasodilation. Then other also agents are there, which can be there. Example of these are hydralazine and all. So vasodilator, again you please go through all the drugs you have studied in hypertension. Okay, because these are all drugs, they are categorized as a vasodilator. You know the basic benefits of the vasodilators. What are the benefits of the vasodilators? They will cause vasodilatation. Because of that, there will be venous pooling if it is a venodilation, and if the arterial dilation, then this arterial dilation will cause what? Decrease in the blood pressure. The decrease in the blood pressure will cause decrease in the afterload, while if the venous return is reduced, because if the veins are dilated, more blood will remain in the veins, and if the blood is remaining in the veins, then its return to the heart will reduce. Thus it will reduce preload, it will reduce afterload, and because of that this will be useful. These are started normally in low doses, and after a certain period, once improvement is there, it can be discontinued slowly or gradually. If it is abruptly withdrawn, if they are stopped abruptly, then they will cause the rebound vasoconstriction. So these are various drugs which are used. As I told you, digoxin we shall be studying later. This is the only new agent actually which you are going to study. So we'll just make a discussion on digoxin, and then once digoxin is over, that means this drugs acting for heart failure will be over. I repeat, you please go through again the various details which you have studied.